All right, welcome back, you guys. It is time for your health check. I want to start with something that is dominating the headlines on the internet right now as it relates to COVID-19. Podcast host Joe Rogan says he has COVID, and the way he's treating it is raising some eyebrows.
All kinds of meds, monoclonal antibodies, Ivermectin, Z-Pak, prednisone, everything.
Okay, wow, everything. So yeah, you heard it there. One of those treatments that Rogan mentioned is Ivermectin. Here's the thing. It's widely used, as we've talked about before, as animal medication, and people have been using it to treat COVID-19, something the FDA warns you should not do. So what is it and how did this experiment start? Jay Wallace explains.
Ivermectin. It's a complicated word for a compound chemical formula that has become a confusing topic of conversation. So let's clear some things up. This mixture of carbon, hydrogen, and oxygen was first modified and introduced in 1981. It soon became registered around the world to treat parasitic worms in cattle, sheep, and other animals. By 1988, ivermectin was approved as a medical treatment in humans for one specific purpose. This wonder drug was prescribed to treat illnesses like onchocerciasis, strongyloidiasis, to put it more simply, different types of parasites. So why are some doctors prescribing it to treat a respiratory virus like COVID-19? A medical study led by Dr. Ahmed El-Ghazar in Egypt that was published last November said that hospitalized patients with COVID-19 who received this anti-parasitic drug improved more quickly and had a better chance of staying alive. It was retracted in July. Multiple medical agencies, including the CDC, FDA, and NIH, all have been unable to find any evidence this drug helps with COVID-19. That's one reason medical groups are warning doctors and patients. In mid-August, U.S. retail pharmacies handed out more than 88,000 prescriptions of ivermectin in 1 week, according to the CDC. That is nearly 25 times more than the average before the pandemic. Medical experts are also concerned about the dangers of dosing errors. If your dosage of ivermectin is too much or at a level meant for a larger animal, it could have a toxic result and lead to an overdose. So as we fight this global pandemic, medical groups say ivermectin is not a viable treatment for COVID-19, but it does have legitimate medical use to treat parasitic infections in humans and animals. In Dallas, I'm Jay Wallace.
Now here's the thing, you're hearing from top scientists, including Dr. Fauci, that there's no evidence whatsoever that this works. That's a quote. Yet, you may have a friend or maybe you know someone who's used it and said, hey, this worked for me. Well, in science and medicine, that is the difference between anecdotal or personal accounts and evidence-based research. If you've thought about taking this, consider how this would interact with any other medications you take, how it stays in your bloodstream for 18 hours and then your intestines for 12 days, and how if you have a weakened immune system or a chronic illness, heart disease, kidney or liver disease, it could be more harmful than helpful. That's your health check today.